that's just the rippling effects of, of them pulling your funds, doctor. I mean, if they only knew just how bad that was going to put our situation in the community and the work that you're doing and to help these parents of these young kids, it's just, you just tell us about it.
Well, I think I'm over my shock now, I think.
Oh,
But
yeah,
I have to
no.
admit, it takes a lot to actually shock me and actually shut
I
my
was
mouth.
shocked that you didn't even know.
But it did, yeah. Well, because it was totally, based on what should have happened, it was totally unexpected.
Yeah.
And that, I think that was surprising. And so we still, yes. And then there were only 2 Healthy Start sites in Wisconsin, ours and Great Lakes, and they didn't get theirs either.
Oh, no.
Yeah. So there are no Healthy Start sites. I mean, these are 2 areas that clearly, so it's just kind of like, what else is going on?
I know you're trying to find out how did they come to that decision.
Exactly.
And to cut off both of them.
Yeah,
Molly,
yeah.
Can we back up a little bit?
Yes,
And
ma'am.
for those people who might be tuning in that hadn't heard any of this before, can you just briefly tell us what's going on?
Okay. Okay, 1998, actually before 1998, actually in 1990, the federal government established a program called Healthy Start. It was really to try to decrease the infant mortality around the country, and actually it was done under the first Bush. So it's over this time it's enjoyed quite a bipartisan support. I actually wrote the grant, the initial grant for the health department in 1990, and we were what they called approved but not funded. Kind of like where we are now. Approved but not funded. They funded 15 sites, and of course, they were the larger cities, Chicago, New York, Florida, the usual. But they actually ended up getting more money in 2004, so they funded Milwaukee in 2004. Another organization had it at that time. Some issues came up, and so we got the grant in 1998. And that grant really supported a whole, we took the grant way beyond even what they said it ought to be, because we knew it had to be really inclusive community.
Right.
So it wasn't just providing information about health and babies, all that's it. But what it really did for us was allowed us to set up a system that really allowed us to work with families as a whole. And unique in that way. Because I tell people, when we started in 1998, we kind of did the classic case management around their so-called health issues. But as we got more and more into it, it depends on how you define health, and folks have heard me say this before, that we really have a medical system in this country, not a health system. Because a health system believes in prevention. It understands some of the things that President Hall just talked about: incarceration, jobs, all the things make a difference. That affects the infant mortality rates as well. So we started working, when we started off, if we work with women who had their babies in the bureau system, we would kind of just check that off.
Dr. McManus, that was your problem to begin with. You
Was
started
it?
going outside of what you
Okay.
were supposed to be doing. You started helping too many people. You just got too many.
That
you
was
were doing
it. Wasn't
too
it?
good.
Yes, and we were good at what we did. We have evaluation too
Yeah.
to show that we were good at what we did. Not
Right,
to say,
and that's
well, they
what-
don't know anything. No, we got separate evaluation that shows that we did know how to do this. And working with these women who have these babies, like I said, we just check it off before. And all of a sudden we're like, if we really believe this life course piece, then you can't just do that. We make sure they get the health care, we make sure they get this, that, and the other. But losing a baby, then we had these women getting more babies. And I would sit down and talk to them and say, do not have another baby, because you're feeding them into the system. What you're doing is trying to make up for a loss. And all you're doing is getting another loss. But see, the other folks, they weren't talking to them that way.
Right.
We can fuss at our folks, the way other folks can't.
But see,
Yes, ma'am.
we have a phone caller,
Okay.
doctor, and we're just gonna have the caller, and
Okay.
then you can go right back with your information.
All right.
Caller, are you there?
Yes, I am.
Okay.
Yes, I have a question. First, how much was the grant that, as my understanding, as of January 2015, will be no longer given?
Okay, the grant that we were supposed to get up until this competitive cycle used to be 4 years, and it was 5 years. So this 5-year competitive cycle, we got actually $900,000 a year, but they changed it this year. It still would have been $750,000 a year for 5 years. That's what so actually lost $750,000 a year for 5 years.
Okay.
Okay, now here's my question. This is, I remember when Sherwin Hughes on the station prior to college, you were talking about getting the community together and start giving money and to help situations. This is where I see a perfect a situation that could come into play from our community, and that is, if people, would it be okay if, say, checks payable to what, the clinic or what so that
To our
people
agency?
could send in with that
Black
cause
Health
any problem?
Coalition.
Oh, no, no.
Okay, that's what I'm saying.
No, not a problem at all,
I
because,
think we need to ask
Yeah.
the community,
yeah.
look, this is where we as people can do our part and send money to you. So if they don't want, that's still our tax dollars that they're using, but this way we get direct, and I don't know, it is a write-off too, isn't it?
Well, we're a nonprofit, so it's not directly a write-off, but, I mean, certainly will still be, it would be a tax write-off for you,
Yeah,
right, or
yeah,
whoever
for
does it, because
donation,
we
yeah.
are a 501c3. And
So
I think
that's
what's,
what I'm talking about. So that could be an incentive for people who might need things to write off on
Oh,
their taxes.
absolutely,
So,
you're absolutely right.
The thing is, for people to write a check out to, what would be the name of it being payable to?
It would be to the Black Health Coalition of Wisconsin,
Black Health Coalition,
Wisconsin,
Health Coalition of Wisconsin.
or just BHCW,
And
you
your
just write all
address.
that. And then our address is 3020 West Fleet Street,
3020 West Fleet Street.
right.
And while we said a little marathon to say, hey, people of Milwaukee, by the end of this month, let's try to get at least 1/3 of that money in your hands. And if we could keep us abreast of how much you're collecting, how much more is needed, so that we can have what's needed. I know this has to be on an annual basis, but until we
Right.
can find some way to make sure that our tax dollars go to giving you grants to further because you're doing too much good in the community to allow that
Right.
to not
Oh.
give you money.
Well, thank you very much. And you know, another thing too is that it really affects our whole agency, because that grant was 80% of our budget.
Yes.
So, you know, out of my 14 staff, I'm gonna lose probably 10 of them.
Oh, wow.
Okay, well,
And-
what is the soonest that you gotta have something to keep from losing staff?
We do have funding until the end of December.
Okay, so that will be our goal, to have it by November, so that, because we want to give a notice if we don't get it, but we want to make sure that with the people, the money we got in our community, we should be able to make that, at least for this year, till we can work on something on a little more formal
Yeah.
to on a regular basis.
Well,
So,
help,
community-
anything will help.
Okay, thank you, Ms. Rose. We really appreciate your
Thank you.
suggestion, and we'll just see. We got a fundraiser going here now to make your checks out to the Black Health Coalition, 3020 West Philly
Philly
Street,
Street,
Milwaukee, 53208. We have a break coming up, and then as soon as this break, we'll be right back.